Hi, good morning. This is Dr. Shreen, Assistant Professor, Forensic Medicine Department, working in Lakshmi Narayan Medical College, Pondicherry. Today, my topic is about impotence and sterility. What are the questions of this chapter? First is sterility, impotence, rigidity. What are the causes of impotence and sterility in males? What are the causes of impotence and sterility in females? And comes to sterilization, artificial insemination, that is ART, and test tube babies and surrogate mothers. What is impotence? A person who is not able to perform sexual intercourse. Phases of the same in men, that is erection, maintenance of erection, and ejaculation. AKA, that is erectile dysfunction in male, the consistent or recurrent inability of man to attain and or maintain a penile erection sufficient for sexual performance. First international consultation on erectile dysfunction convened by WHO, that is World Health Organization, in the year of 1999. Recurrent inability is being 3 months or greater in duration done by National Institute of Health Conscious Canada. So what is meant by sterility and infertility? Infertility, that is inability of a male to beget a child. Second is inability of a female to conceive a child. Third, the inability to conceive after 1 year of the conjugal life without use of contraceptive methods. What are the circumstances? First is civil, cases of nullity of marriages, divorce case, paternity disputes, legitimacy, workman compensation cases. Second is criminal in case of rape, adultery, and unnatural sexual offenses. What are the causes of female impotence? First one is rigidity, that is inability of women to initiate or maintain sexual arousal pattern. What are the etiologies for this? Is first is psychogenic, that is sexual aversion disorder. Second is dyspareunia. Third is vaginismus, and the fourth is malformations. What are the causes of male impotence? First, anatomical causes, vascular causes, central causes, peripheral causes, and psychogenic causes. What are the anatomical causes? Is Peyronie's disease, micropenis, and penile anomalies, that is hypo and epispadiasis. What are the causes in vascular? First is cardiovascular disease, atherosclerosis, hypertension, diabetes, hyperlipidemia, smoking, and trauma. In central causes, that is Parkinson's disease, stroke, multiple disorders, sclerosis, tumors, spinal disease, and spinal injury. Then peripheral causes is poly and peripheral causes, neuropathy cause, diabetic cause, alcohol cause, uremia cause, and the pelvic surgery cause. What are the causes of erectile dysfunction? First is heart disease, diabetes, smoking, drinking, and medication and surgery. The psychological causes, that is the factors, is by stress, anxiety, and the depressions. So now we can see the physical cause and the psychological cause. It's the same what I explained before. What are the diabetic men with erectile dysfunction? The main cause of diabetic men with erectile dysfunction is smoking may reduce the blood flow and cause the impotence. What are the causes of erectile dysfunction in smoking? There will be a link, that is cigarettes may cause sexual impotence due to decreased blood flow to the penis. This can prevent you from having an erection. Then comes the psychogenic cause, the persistent inability to achieve or maintain an erection satisfactory for sexual performance, owing predominantly or exclusively to psychological or interpersonal factors. In the society, the International Society of Sex and the Importance Research. There are two types of psychology cause. First is immediate cause and the remote cause. Immediate cause, that is performance anxiety, lack of adequate stimulation, and the relationship conflicts. When compared to remote cause, there will be childhood sexual trauma, sexual identity issues, unresolved partner or a parental attachments, and the religious or the cultural taboos. These are the causes of psychological causes of impotence. That is, first is stress and anxiety, then confused sexual orientation, then depression and other mental health issues. Fourth is performance connected anxiety. Fifth is relationship issues. What is mimic product heart and bridegroom syndrome? First, that is, I is heterogenic, M is malformation, P is psychological, O is obstructive, T is trauma, E is endocrine, N is neurological, C is congenital, and E is excessive. What is the male infertility causes and symptoms and treatments? The causes of male infertility is, first is the 34% is unexplained, and 8% is undescended testicles, and 9% is urogenital infection, 6% is asexual factors, and 3% is by systemic disease, 17% by varicose, and 5% is by immune system factors, and 10% is by hypogonadism, and other issues by 8%. Then comes to male infertility disorder. First, the 10% is semen disorder, 9% is testicular failure, 7% is other issues, 6% is obstruction, another 6% is a cryptochromidism, and 37% by varicose, and 25% by idiopathy. What are the causes of infertility? First cause is disorders of spermatogenesis. It classifies into two, that is, A is hormonal and B is primary testicular disorder. When it comes to hormonal, there are three types. That is three disorders. That's hypothalamic disorder, pituitary secretion of FHS and LH, and hyperprolactinemia. When compared to B, that is primary testicular disorder, there are three. First is idiopathic varicose and chromosal defect, that is Impotence syndrome, and the cryptochromidism. What are the causes? That is continued by the primary testicular disorder, that is drugs, radiation, orgies, traumatic months, TB, gonorrhea, and the chronic illness and the immunological disorder. Second is duct obstruction, that is causes will be congenital absence, inflammatory block, and the surgical trauma. Third is accessory glands disorder, that is protus and vasculitis, congenital absence of vas, and the cystic fibrosis. Fourth is disorder of the sperms and the vesicular fluid. In this, there are four disorders, that is sperms, antibodies, and low fructose in the seminal plasma, sperm acrosome defect, zona perizuria binding defect, zona penetration defect, or fusion defect. Fifth is sexual dysfunction, that is low frequency coitus, wrong time, impotence, hypostasis, premature ejaculation, retrograde ejaculation. Sixth is psychological factors and the environmental factors, includes smoking, alcohol consumption, and tobacco chewing, and the diabetes. Seventh is drug. What are the drug causes the infertility? That is, first is antihypertensive drug, antipsychotic drug, sex steroid drugs, chemotherapy, beta blockers, and spironolactone, and the estrogen drugs. These are the female infertility causes. First is another unexplained causes by 10%, cervical and mucus by 2 to 3%, endometrial uterine by 2 to 3%, pelvic and peritoneal by 5 to 10%, tubal by 30 to 50%, and the developmental and genital disorder by the 40%. What are the major causes? Primary cause of infertility, I explained, that is 5% is other causes, 5% is vital problems, 9% is endometriosis and the cervical mucus, 14% is tubal damage, 18% is ovulatory failure, and 21% is sperm problem, and 28% is whether it is unexplained. So these are some of the causes of female infertility, that is congenital anomalies, acute factor, urogenital infection, immunogenital factors, tubal damage, ovulatory failure, endometriosis, anomalies of the uterus, and the endocrine dysfunction. What are causes of infertility in women? That is dyspareunia and vaginal causes, congenital defect in the genital tract, infection in the lower genital tract, cervical factors, uterine causes, tubal factors, ovaries, peritoneal causes, and the chronic illness, that is thyroid dysfunction. The possible cause of infertility is first is blockage of the uterine tube, and there will be a polycystic ovaries, there will be polyps, and fibroids will be present, and any other infections we see, and endometriosis and endometrioma will be seen in some patients, and any addictions will be added in over the endometriosis. So what are the causes of infertility in female? That is first one, age, that is extreme precocious puberty. Female get this causes, and disparity of the organs, and development defect, that is congenital, that is Turner's and congenital dysgenesis and acute defects. Disease will be a general and the local. Psychological will be vaginismus. What is the ovulatory dysfunction? That is, it is an hypothalamic amenorrhea. In pituitary, there will be a prolactinoma and hyperpituitarism, Cushing syndrome, and renal and hepatic failure. In ovarian causes, it includes polycystic ovarian syndrome, premature ovarian failure, and the luteal phase defect. And in systemic disease, there will be a thyroid and Cushing syndrome disease, and renal and hepatic failure. In congenital, it will be a Turner's syndrome and the gonadal dysgenesis. In psychological, that is will be a stress, nutrition deficiency, and the excessive exercise. What are the outflow tract of abnormality? First is tubal factors, that is there will be a pelvic inflammatory disease, additions, ligation, and ovulation due to ectopic pregnancy. Next is uterine factors, congenital, that is bicornate septate and congenital DES exposure, and in intrauterine there will be Eisenman syndrome. Infections like the pelvic tuberculosis, being pelvic tuberculosis and endometriosis, and fibroid and endometrial ablation will be seen. In cervical factors will be a hostile cervical mucus and anti-sperm antibodies, and structural factors, that is sperm biopsies will be present. What are the psychic causes? That is a vaginismus, that is a spasmodic contraction of the vagina due to hyperplasia, may affect the perineal muscles or only single muscle like levator, and the vaginal outlet may have involuntary reflex stimulated by the imagined, anticipated, and real attempts. The etiological factors would be a male sexual dysfunction and the pure sexual trauma, and the secondary to the disparity. How will you report this case? First is abnormality. You should write there is an evidence to suggest that the person is incapable for performing sexual intercourse. But the other investigation you can do is vaginogenic, and that is anterior and or venogenic, and papaverine injection will be seen and given, and in the ultrasonography. Right? Ultrasonography we can report. The first is abnormality. It should be written in like this. There is an evidence to suggest that the person is incapable of performing sexual intercourse. When compared to the normal cases, if there is nothing to suggest that the person is incapable of performing sexual intercourse. The opinion of writing this report should be like this. Thank you.